got Matt online now. Hang on. Yes, there he is. Over to you, Matt.
It's in presence of you now. Sorry, Emma.
Perfect. No worries.
Okay. Wonderful. Thank you so much, and thanks everyone for the opportunity to share this project. So just for a bit of context, this is just about to kick off. So at the very early stages of this project. So what I'd really like to do is to spend a few minutes just sharing the sort of vision and approach that we have for it. So the project is called Care Data Spaces, and I'm going to be presenting today on behalf of my colleagues at West Midlands ADASS, but this is very much a collaborative and co-designed project. As you've already heard, I'm based at the University of Birmingham and also the ESRC Centre for Care, and this is a project that has been funded via the ESRC and agreed with colleagues at the Centre for Care as well. And I'm sure everyone knows colleagues on this screen, but this is Pete Jackson, Paul Johnson, and Caroline Vollers-Lewis, who've been really fundamental in the work that we've done and the strategic approach. So just to give you a really quick overview, the central question or the central motivation is: can we create a data system that allows people to understand and improve social care support and wellbeing outcomes? And we're really interested to know if we can also make this system a sustainable part of the national infrastructure, something that colleagues in practice and people with lived experience are using every day as part of business as usual model. So this is the other key feature is that we really want this to be part sort of operational research and learning endeavour. So using routine data as part of business as usual models to inform practice, to improve decision making, to understand insights. And I think if we could sort of boil everything down to two main aims, the first aim is to really inform national insights using mandated aggregated data and linking that information to census information and other geographical information. And then the second piece is around client level data. So working closely, particularly in the West Midlands, the 14 local authorities that we have there with their client level record analysis and linkage to other administrative records as well. We also want to be able to create digital tools and technologies that resolve challenges around adult social care, and we want to embed in learning and improvement into the process of delivering care as well. So for those of you who might be a little less familiar with the adult social care context, it's one that's where there's increasing pressure to use data intelligently and effectively. People often describe it as being more poorly served by quantitative or numerical data and ways of analysing it compared to other sectors such as health or education, for example. When we talk to people about the work that we wanted to do, they often said that it was difficult to know where to begin with data, how to balance competing priorities that emerge from the data, but also in terms of their practice and the things that they're doing in their daily roles. How to ensure balanced and impactful development, and how to find time and resource to better understand and learn from the data. So the result, when you bring all that together, is that there are limited insights into adult social care, limited knowledge of what works best for whom and in what circumstances, and reduced ability to develop data skills and to learn as part of roles. So the five main things, and I'm going to be showing a schematic in a second, that brings all this together, is we really wanted to co-design and co-produce this piece of work. So that's fundamental, that's central to everything. So can we create a digital learning system with a community of practice, with a lived experience panel, with people who are working in practice every day to understand how the system can be beneficial for them and for the priorities that they have and the ways of working that they have. With that, we want to then develop a data infrastructure and analytical service to understand adult social care, so understanding intersectional inequalities, informing practice change for local authorities, using aggregated data and census information and geographical data as well. And I think most importantly, the key thing is that we are creating resource and capacity to do that analytical work on behalf of colleagues in practice, if that's something that they would find beneficial. This isn't necessarily a system that we're setting up and letting be for people to use, which you can do, but we really want to be part and embedded in that process to provide that resource to be able to provide insights for colleagues. We also want to understand how we can develop a safe and ethical and reproducible process for preparation and analysis of client level data that captures individual care journeys and people's lived experience. We want to work across academic and practice boundaries to understand what works and how the data can be used to inform routine practice and learning support in adult social care, and the implementation and evaluation of the data system. And so this is a schematic that brings all this together, where we have a work package around building the community of practice, the care data spaces, the client level data, using those pieces of information to create impact case studies so that people, short 2-page insight reports, for example, that describe a priority area for the colleagues in practice who've informed that analysis. And then number 5 is just the implementation and evaluation process. So in terms of the building the community of practice and experience, we will, as I've said, we will co-produce the system, setting that community of practice will really set the agenda, the research questions, the priorities that we have. So we want to really give our power and enable them to set the agenda and what it is that we are doing with this. Ensure that outputs therefore meet the sector needs and are sustainable post project, and hopefully this is a longer term sustainable piece of work as well. The community of practice and experience will focus on the lives that people want to lead, so that there's choice and control in the way that in the thing that people are that people experience. When we want to work with people who have experience in social care, along with commissioners, practitioners, policymakers, to develop this digital learning tool to inform daily practice. As I mentioned, the main piece that we're talking about today is the care data spaces, so how we bring that aggregated mandated data together, the census information, the geographical information into one place to inform decision making and improve understandings of intersection inequalities and need. Create this virtual data space and a dashboard for interactive mapping and analytics. Insights and analyses will be upscale and automated and replicated. So one of the things that we're really excited about is that once we have a few priority areas from a dozen local authorities, we can automate those priorities across those local authorities, but also upscale that nationally. So that's something that we're hoping to do. So it's not just something that the community of practice and experience benefit from, but it's something that we can roll out and upscale as well. We're also going to follow the open science framework, so all of our files and code and analyses will be publicly available, and will be publicly available in local authority files. And we also want to create learning resources around this. So while we are proposing to act as the analytics team to build the system in different ways, but also to provide the analytical insights, we also do want to create those resources where colleagues will be able to do those things for themselves independently. So this all builds on the strategic framework of ADASS, which is available on their website, which creates an analytical capability roadmap. And lots of colleagues will already know that they have this wonderful data hub that's already that already exists. And so this is brought this is a really accessible tool that people can access and can look at their local areas and understand a whole range of things in relation to adult social care. So things like assurance metrics, care market profiles, finance profiles, population in need, performance metrics, and workforce profiles. So the idea is that we'll be able to combine this with other census information, other publicly available information to really understand how things have changed over time and place, but also longer term use for forecasting and providing insights moving forward about what will happen and what's needed in the future. Just as an aside, we also have created a number of dashboards and other topic areas as well, which we are proposing to use as well. So this is the unpaid care dashboard that we have developed at the Centre for Care, where we've brought together all census information into one place over time. And this allows us to understand the intersectional profiles of unpaid carers. We can break this down by a whole host of social characteristics. And we have also created a number of different resources for this as well. So again, this is all completely automated. Colleagues can enter their email addresses and they can request all the information from the dashboard. This is all publicly available as well, with cartoons and animations that help to understand how to interpret the stats that we're providing in terms of unpaid care. It also provides an instant automated service where all the stats and the PowerPoint presentations and all the information from the dashboard are sent directly to colleagues who want that information, and we've had quite a lot of uptake in this kind of work from charities and advocacy groups, etc., who are using this information for a whole range of reporting and case study development, business cases, etc. So we'll be following a very similar approach. So this brings me to the work package around client level analytics and linkages, which again will be driven by the community of practice and the CP, the community of practice, working directly with the 14 local authorities in the West Midlands to understand data collection processes, metadata for analysis and processing, etc. The implementation, I think one of the key things that we're developing as well is that we are using what we call strategic improvement coaches, where we are paying the time of practitioners in local authorities to use the tool, to take that tool and to embed it in the systems and the working that they have. So we really want to be able to not only provide the resource ourselves, but we also want to create that resource for those colleagues as well. We want to be able to develop learning materials, as I've said, so free and open access resources, training programs and short courses around the systems, videos and animations, doing so as well. And making sure that everything is freely available as best we can in terms of open science practices. We also have had ideas for other possibilities for the work. So once we bring these data assets into one place, is it possible, for example, to use them to inform national statistics on things like unpaid care or disability, for example? The system is also possible to not only bring together publicly available data, but we can also partition different parts of the dashboard for private provider data that might not be made publicly available. So we can look at other elements of adult social care as well. As I mentioned, some of the analytic and forecasting functions that we can look at as well to understand future scenarios. And something else that we're quite excited about is that a lot of the information that we are able to ingest also includes unstructured data. So there's a capacity to be able to use large language models and natural language processing to explore the information in that unstructured data in terms of case notes and inspection reports, etc., to build up a sort of richer, more nuanced picture. So just very quickly for the last few minutes, why this matters. There's a strong and growing government interest in better, richer and more usable adult social care data. Local authorities currently operate with fragmented, inconsistent or inaccessible insight. The national expectations are rising in terms of care quality commission reporting and expectations. Integrated care system pressures, etc. There's limited actionable evidence on what works in adult social care, often difficulty linking adult social care data with other geographical information, insufficient capability to use data at pace to support day-to-day decision making. So we're proposing, and if I can just boil everything down into what we will deliver, a modern day data infrastructure which is integrated and transparent, open where possible and secure where needed. Data analysis at scale, combining public adult social care data, geographical information and information on local context, customized local reports tailored to the needs of local authorities or people in practice. They will have this interactive data site, which I've already shown you two versions of, the data hub that already exists, but also the unpaid care dashboard, integration support, so helping councils use insights in commissioning, workforce market shaping, etc., and a range of learning resources around that. So what are we learning currently? We're learning that councils want insight that is timely, simple, flexible and grounded in their lived reality. Lived experience partners add dimensions that data alone cannot reveal. So there's lots of silences in the data. I think it's really important to note that, as well as everyone knows. Workforce constraints means tools must reduce burden and not create more work. The appetite for cross council benchmarking and shared of sense making has been really strong. This can be used to improve the readiness for CQC assurance, supports place-based planning and integrated care system alignment, creates a shared evidence base for commissioners, providers and lived experience partners, enables quicker and more confident decision making, and embeds open science throughout. And I guess the last slide that I'm just really keen to share, and before I stop, is just an invitation, an open call for invitation and collaboration. We're really interested in understanding or working with colleagues on the call. We'd really love you to join the community to help us shape what the priorities might be, or what you might need from something like this. Explore opportunities to pilot and learn from the platform. Help to define new data sets and better ways to capture lived experience throughout this process as well. And work with us to ensure that data is a tool for care, inclusion and wellbeing, and not just one for compliance. Thank you so much.
Thanks very much, Matt. We've got 1 minute for questions. There's two in the chat, in the Q&A, and one in the two in the chat as well. But thank you for a great presentation. So first question, are all of your local authorities on the same system? And if not, how did you overcome any issues bringing the data together? Very quickly.
Yes, so they are on the same system, and so that was just there are lots of data sharing agreements. There's lots of compliance and governance that went into that, which was a lot of hard work. With some of the aggregated data, it's less so because that's all publicly available. So that was just bringing that together in sort of more standard ways. That wasn't so much of an issue.
Excellent. We better stop there because I know we've got our final keynote speaker talk that is starting right now. So we better let people go. But if you are able to stay on to answer the questions in the Q&A, that would be fantastic, just so that people know how to contact you and things like that. But thanks again. Great talk. And yeah, that's the end of this session. Goodbye.
Thanks everyone.